There is a debate on the ethical standard of applying wilderness medicine towards disaster-struck communities. Traditionally, wilderness medicine involved the practice of medicine in remote environments. Wilderness practice includes environmental illnesses, mountain medicine, travel medicine, as well as global health issues related to austere settings. Such practice nearly always requires decision-making with limited information about how to distribute scarce resources. Disasters in resource-poor settings, including humanitarian emergencies with the loss of certain infrastructures, may be considered austere environments as well, with similar resource allocation challenges. In any austere setting, how should limited resources be distributed? Distribution strategies might benefit some and potentially hurt others. Which resources are most important given limited time, space, and funding? Resource allocation is based on aggregate rather than individual good, perhaps one of the strongest similarities between these two diverse fields, making the decision-making processes concordant. For example, mountain search and rescue teams limit the resources they carry during a search. They operate with only the supplies that they have transported to a remote setting, and make allocation decisions about whom to evacuate first, or which patients will benefit from access to a helicopter. In disasters, limited resources such as medications, vaccines, and airlifts are allocated via a similar thought process. The overlap between wilderness medicine and disaster response means personnel trained in both are more versatile and more likely to succeed with limited resources. Wilderness medicine skills, situational awareness, survival, and improvisation are key pre-deployment skills for practitioners entering any disaster or humanitarian relief setting. Those practicing in such settings will benefit from a traditional wilderness medicine curriculum along with training in humanitarian response and public health. Clinicians and first responders with this hybrid background will be able to do the best possible good for their patients, be they with a single victim in the wilderness or faced with a disaster affecting thousands.